Breast cancer is the most commonly diagnosed cancer among African American women.
I did cry about when I found out I had breast cancer because in the beginning I was thinking about more of death.
Breast cancer is the second most common cause of cancer death among African American women, behind lung cancer.
Because I didn't know how to share it. It was just like your whole life just shut down and just stopped. Because at this point you're thinking, I'm gonna die.
More than 26,000 African American women are expected to be diagnosed with breast cancer by the end of 2011. About 6,000 will die, but more than 20,000 will call themselves survivors.
We still have those memories, those negative connotations when it comes to words like cancer. And we still think that when you mention cancer, that's the deathbed. And that to me is why I'm so proud you're doing what you're doing, because we have to change the image. We have to change the meaning of the word cancer.
The National Coalition of 100 Black Women West Palm Beach chapter commissioned this video to help spread the real facts about breast cancer. Some of the chapter members sat down with researcher Dr. Gwen Randall. Dr. Randall says the excessive emphasis on death is because not enough African American survivors admit to being survivors, and too often we only hear about those who have died of cancer.
That has made an impact in our community in terms of, yeah, she had breast cancer and she died, and she went for treatment and she died, and I know her mother went for treatment and she died. But what people don't understand is, and I can't stress this enough, that diagnosis is very, very important.
And you can put your head right back, and you can bring this hand above your head.
New research and technology has led to early detection and promising treatments for breast cancer, and the overall death rate has declined, but not quite as much for women of African descent. African American women on average have a 34% higher death rate from breast cancer. Some of it is due to disparities in access to treatment. Some of it is due to waiting so late to seek treatment.
And people need to understand that breast cancer is changes in cells. The normal cells become abnormal. If you don't do anything about them, they just grow wildly, crazily, out of control, and that's when you get your different stages of cancer. You know, 1, 2, 3, 4. If it's contained, that's a good thing. When it grows wild, you know, like weed somewhere, that's the problem.
Stage for stage, we can treat black women as successfully as we can treat white women. One of the differences is that Afro-American women have a higher incidence of what we call triple-negative breast cancer. Some of those are very aggressive. In the United States, it's about 20%, 22% of Afro-American women that get breast cancer have a triple negative. Not all of those are terrible, aggressive cancers, but a disproportionate number of them are.
Dr. Alapati, who's a researcher at the University of Chicago, has looked at breast cancer in Nigeria, which is where she's from, and just like in our country, where young African American women tend to have this triple negative breast cancer, which is a very aggressive type, they have that same type in Africa. So we think that it's a genetic variant.
Is there any way of detecting in advance whether a woman might get breast cancer? Research has shown there are some things that may put a woman at slightly higher risk. Family history. About 5 to 10% of breast cancer cases are thought to be hereditary. Lack of physical activity, obesity, drinking more than 1 alcoholic beverage a day, starting menstruation before age 12, starting menopause after age 55, having no children or having a first child after age 30, long-term use of birth control pills, long-term use of hormone replacement therapy. But keep in mind, a woman could have none of these risk factors and still get breast cancer. Britnee certainly didn't have risk factors. An active young woman who played high school basketball, last year Britnee was working and going to school while pregnant. 6 weeks after she had her baby boy, Britnee went to the doctor.
I went to the OBGYN and the midwife while she did a breast exam, and she found the lump. she sent me to St. Mary's to do a breast ultrasound, and they said it was a cyst. So we went on from there to do a breast mammogram, and they went in and they cut me twice, and they took samples of both cuts, which they said was 2 different tumors, and one was cancerous and one wasn't. But when I got the surgery, it was all one mass, and it was 10 centimeters, and they found out that both was cancerous. I was in a state of shock. I didn't cry at first. I understood what they was saying, but I didn't believe it. But it hit me later.
Britnee had both breasts removed, a double mastectomy.
For women under 35, mastectomy has been recommended just because they're so young and their cancers tend to be more aggressive. So there you don't have the choice. For women over 35, lumpectomy and radiation may be a choice, and the women can preserve their breasts.
I had my moments for a while till I understood that crying ain't gonna make the situation better.
This is a strong young lady. Even from when she was coming up, she played pee-wee football and basketball and truly outdoing boy. So she's a fighter. Anyway, she's tough as nails. You know, even high school basketball games, tough as nails. So she's a fighter. And I fight like a girl now. There's no doubt about it.
Britnee's parents have been with her every step of the way.
It was just hard to believe. A 20-year-old breast cancer. Just completely hard to believe. But we jumped on the ball, got on Facebook, started talking to friends. You would not believe the information that I got from Facebook, just from friends.
Her dad presented Britnee with a pink iPad to stay connected. In fact, Britnee's dad is now always decked out in pink and proud of it.
I wear pink for my daughter. But everybody I run into, I tell her story. I tell her story because her finding that was truly lucky. And if a year from now, it'd be a whole different story. You know, we'd be talking differently.
And definitely young women have lumps. And they're usually fibroadenomas that are benign, but they do need to be worked up. In the past 2 months, I've had 2 young girls. I think the first one was 16, and the recent one was yesterday, and she was 15, that did have a small lump.
Dr. Joni Albrecht is a pediatrician at Found Care Clinic in Lake Worth. She says as soon as girls develop breasts is the time to teach them how their breasts should look and feel.
With the message, not that they're looking for cancer, but just that they get to know their own bodies. And I show them that little granules that can be normal, and to get to know what their breasts are like and how they change with their periods. And if there is a spot that doesn't seem to change, or it's getting bigger, or anything that bothers them, they should always bring it to somebody's attention. And so it's not as much say, oh, you're searching for cancer, it's get to know your own body.
So when they are grown, they will already be comfortable with breast self-awareness. Found Care nurse practitioner Elsie Remy teaches women what that means.
You should be looking in front of a mirror, you know, topless, looking at the symmetry of your breast, making sure that the nipples, you know, there's no changes in the nipples. If a nipple becomes inverted, that may alert your attention. Maybe there's a difference in your breast. If there's any sudden discharge, you should be looking at. You should be standing in the mirror with your hands on your hips to be able to flex, to look at your pectoralis muscle and make sure there's no retraction or what we call pulling or puckering of the muscle, to look to see there's the same consistency from month to month. And the more you do it, the more you become familiar with the texture of your breast. So if there's any changes, you will be the first one to know.
What kinds of changes should a woman notice? Lump in the breast or underarm, thickening or swelling of part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple or breast area, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk, any change in the size or shape of the breast, and unusual pain in any area of the breast.
I just saw a patient this week that her doctor said, well, your lump hurts, that can't be cancer. And of course it was cancer, and by the time it was found, it had spread to the lymph nodes. But that could have been prevented if the doctor was more informed and the patient had the confidence to say, I want a second opinion.
A woman should have a clinical breast exam performed by a professional every 3 years once she turns 20. But at the first sign of anything unusual, see a healthcare provider as soon as possible.
Half the cancers that women find themselves, they find just by looking at themselves in the mirror.
That was indeed the case with Deidre, who noticed a small lump a few months before she had it checked out.
It kept protruding, it kept growing, and I said, this doesn't feel normal, it doesn't feel right. So I called my regular doctor, you know, so she told me to come in, and she checked me, and she said, honey, you know what? She said, I think you need a mammogram.
That led to a biopsy, which confirmed breast cancer.
Immediately, I shut down, and you know, you're a Christian and all, but you're saying, okay, this is real life stuff hitting you, and that's how I felt. I felt like this is something, and I was in denial for a minute. And my doctor, she was very supportive. The surgeon, she was very supportive. She asked me, did I have family members, you know, that I can talk to, because it's going to be a long journey.
Once the diagnosis is made, and that's usually by a needle biopsy, then you sit down. Often now the idea is that you sit down with members of radiation therapy, surgery, and medical oncology, and as a group, and which includes the patient, you decide which way you want to go.
I didn't have my breast removed. I had a lumpectomy. Thank God that they didn't find it in my lymph nodes. They did remove all the cancer out of my left breast. Of course, I was a stage 2 when they found out, and if I had ignored it, it would have probably progressed, probably right now, to a stage 4.
By knowing the facts, if breast cancer develop, it will be detected early, and early detection is fortunately the answer and the cure, and the hope that we can get control over their disease. And so it is very important that they look at this video and see what we have to offer and what patients have had to say, and be encouraged by it.